And joining us right now from Hannibal Regional Hospital, it's registered dietitian Nancy Hayes with this week's Healthy Dose of Information. Good morning, Nancy.
Good morning.
You do have some healthy information this morning as you talk about how diet can help you be healthier, and that's a very valid point.
Yes, in general, nutrition can make a big impact on a lot of different disease processes. We can prevent a lot of illnesses and diseases just by what we eat over our lifetime.
Is there a difference in what a person should be eating during the treatment for cancer or after treatment is completed? I mean, I know once you have that diagnosis, you're going to be going through the processes of hopefully healing. And does the diet change during those times?
It can. During the initial, what I call phase, when a person is going through treatments, our main focus is actually symptom management and watching just to try to make sure people maintain their weight status and get enough calories in. Because if you become too malnourished during treatment, you may have to postpone treatment, stop treatment for a while. So that's also detrimental. So we focus mainly on just getting enough calories in during that time. Now, switching over once treatment is done, we do look at nutrition a little differently and looking at the amount of nutrients that we can get in that can be protective for a person, maintaining a healthy weight or getting to an optimal or healthy weight, and just minimizing the risk for recurrence of cancer even.
That's a good point. I would imagine some of the tougher things during treatment is just getting people to have enough intake to keep them healthy, right?
There's some types of cancer that people are at a much higher risk for malnutrition. Head and neck cancers or any GI tract cancer, pancreatic, lung, different ones that, yeah, our focus is just making sure they eat in whatever form it be, whether it be sugary foods, high fatty foods that they may tolerate the best. Treatments are hard to go through, and there's a lot of side effects that can happen that we've got to work with and manage.
Right. And as a dietitian, I would suppose that your focus is on having people eat healthy to begin with so they don't end up diagnosed with something like diabetes or maybe cancer or something that could be attributed to that.
Correct. There's been studies out there showing that up to 30 to 50% of all types of cancers can be related to nutrition and what we eat. So nutrition makes a huge impact on our health. And that's diabetes, that's heart disease, that's any of those. What we eat makes a difference.
So in our culture, in this society, what do you call eating healthy? What's it look like?
Focusing on a lot of complex carbohydrates, so the legumes, the dried beans and peas, working in a lot of vegetables and fruits, working in the high fiber sources, the brands and such. Lean protein sources, we've got to have protein in our diet, but it's choosing the fish, choosing the chicken, the lean porks or the very lean beef to get the protein sources in. Limiting some of the saturated fats and trans fats. So a lot of those red meats have more of the saturated fats in them, or the processed foods that would have the trans fats, which are the stick margarines and the shortenings and any products that are made with those.
Yeah, you really need to watch what's in those too.
Yes, we got to look at labels and look at ingredient lists to see what exactly is in those products. There can be a lot of misinformation on there too. You look at the front and it says it's whole grain or it's whatever, but if you actually look at the ingredients, sugar may be the very first ingredient in that product still. So it's really looking at the item. Yeah,
you really do need to look into it and make sure that what you're buying is what you think it is. And like you say, I mean, I hear people talk all the time even about juices and things like that, and a juice that you're drinking may just be full of high fructose corn syrup and not necessarily a good juice that's healthier for you.
Correct. In general, juices aren't going to be the best. If it's between that or nothing, then yes, do a juice, but it's 100% whole fruit juice that you'd want to get. And limiting yourself to about 6 ounces a day of juice itself, you would prefer to get your fruit servings or the nutrients out of the fresh fruit or even some of the canned fruits, as long as they're not packed with the extra sugar in there also. Those fresh fruits are going to give you extra fiber too, which is a huge benefit too.
Do you recommend organic?
Organic is fine and great. We get our nutrients out of either one of them though. Organic, they're going to be less pesticides potential and herbicides and such. They have found through the studies that it's a very small amount that is actually in those foods that they're grown traditionally, but in the general Yeah, you know, if you can go more organic, that's fine. The thing is cost, you know, accessibility and such, and if you can't do the organic, the traditional is just as fine too. You still get the nutrients out of them compared to not eating any of them.
Exactly. You're just wanting people to get to the fruits and vegetables. Okay. What about soy products? Interesting question here. Are soy products okay to eat for people with cancer?
There's a lot of controversy there. Some of those hormone sensitive types of cancer, some of the breast cancers and such, there's been a lot of talk out there about soy products may actually make it worse. From research, whole soy foods, which are going to be the soy milks, the edamame, the tofu and such, eating up to 3 servings of those a day have shown no detriment and can be beneficial for people, especially those that have had soy products in their diets throughout their lifetime. They can show actually benefit of reducing recurrence in a lot of types of those types of cancers. On the other hand, though, the soy protein powders, the isoflavone supplements and such may be detrimental to those patients with the hormone sensitive cancers for the fact that they have such a high concentration in them and can be a little too much.
Again, it's going to depend on the product.
Correct.
What about fats? Are they good, bad?
There's some good fats and some not so good fats in there. The good fats are going to be your omega-3 fatty acids, which are going to come from the fish like salmon and tuna. It's going to come from walnuts. They're going to come from flax. They're going to come from those types of foods. Those are good fats, as well as the fats that come from a lot of the nuts and seeds, or monounsaturated fats. They're healthy. They're what we call more of anti-inflammatory type of fats. So they reduce the risk for heart disease, for the cancers and such. The other types of fats, the saturated and the trans fats, we get out of the animal products, such as the red meats and out of high-fat dairy products. Those types of fats are what we call more inflammatory, as well as the trans fats that I talked about earlier in the margarines and the shortenings. Inflammatory type of fats can create processes in our body, reduce or increasing the risk for heart disease, cancer, and such. All
right. And is there a link between sugar and cancer at all?
Short answer is no.
Okay.
Long answer is indirectly sugar can have an effect related to the fact that too much simple sugars from the sodas or from cakes and cookies and pies and such, it increase our calorie intake, so they increase weight potentially. There is a link with obesity to cancer, to heart disease, to any of those. There also is a link between high insulin levels in our bodies, which sugar increases insulin, but so does weight. Obesity in itself, typically people have a higher level of insulin in our body. The reason that can be a concern is insulin, on the good hand, helps produce more cells, increases our production of cells, which we have healthy cells daily maturing and dying off. Cancer, though, is another cell that just reproduces greatly. So insulin, in theory, can actually help increase...
accelerate that.
Right.
Yeah.
But with that said, a lot of those foods that have shown great potential in reducing the risk of cancer are carbohydrates, or foods that churn to sugar in our body. But it's the complex ones. It's the vegetables, it's the fruits, it's the whole grains. Something else that can help reduce that insulin level in our body floating around, when we're eating foods, make sure we get a protein source, or that high fiber source, or a fat source in at our meal times. They slow down digestion, which slows down how much sugar goes into the bloodstream at a time, which then slows down how much insulin is produced.
Wow, very good points. All part of the holistic approach where everything comes together to impact the effect or the healing process.
Yes.
What are some good sources of fiber, very quickly?
Your dried beans and peas are wonderful sources. Vegetables and fruits, the fresh fruits and vegetables are going to be there. Any of the high brand type of products, all of those are great fiber sources.
Other things we need to do to help prevent cancer or reduce the risk of cancer other than diet?
Definitely. There's a lot of environmental things that are ranked way up high. One of the biggest one is smoking. Stop smoking. Get a healthy weight, because obesity has been shown in so many different areas of increasing risk for chronic diseases. Physical activity is so important. Limiting alcohol, watching the total fat intakes. increasing also those vegetables and fruits, trying to get up to even 8 to 10 servings a day.
Right.
Half a cup is 1 serving, so it's doable.
Put
to
it
get
all
those in.
together.
Yep.
All right. Nancy, thanks for your time.
Thank
It's good
you.
talking to you. Thanks for joining us here in Studio H. It's Nancy Hayes from Hannibal Regional Hospital. You can call the hospital at 573-248-1300, or you can go to hannibalhealth.org for access to all different information and websites as well, right?
Right.
All right. Have a great weekend.
Thank you. You too.
That's your Healthy Dose.